Now, a pharmacy called Springbok Pharmacy in Alberton has been shut down after 2 people tested positive for COVID-19, but officials failed to notify the authorities. This is, of course, in Ekurhuleni. For more, we're joined on the line by the MMC of Community Safety in Ekurhuleni, Frans Mmoko. Frans, thank you very much for being with us. MMC, what happened? I mean, the pharmacy closed down. For how long was it operating under dubious circumstances?
Good day, and good day to the viewers. Look, we went to the pharmacy this morning amid reports and alarming concerns from reports on social media and the staff themselves that there was a reported case and nothing would have been done in as far as their well-being was concerned. So we did not want to downplay those allegations. We went there. We were accompanied by the officials from Health Department from the city of Ekurhuleni. We were then presented with, what was supposed to be precautionary measures, which we were not totally convinced of. And I'll tell you, we were not convinced because the only thing that the pharmacy would have done was to subject the person who tested positive to isolation. But and further than that, they only closed temporarily for a few hours and claimed that they have depleted their stock. But this would be a person who became in contact with a lot of patients because it happened inside their clinic. But it would have happened to a person who got in touch with fellow, colleagues. So we were so surprised that nothing to that effect was done in terms of making sure that they are either pre-screened or subjected to intense tests if they showed any symptoms. Yeah. So they just decided to operate as business as usual.
So no quarantine either, MMC, for any of the colleagues? They weren't asked to self-isolate or self-quarantine?
Nothing. Quite disappointingly, nothing. And I'm saying you can't really want to deal with these issues alone without alerting the authorities. Because we are here, especially the health department, who understand these protocols better than all of us, who can then guide you in terms of the measures that need to be pursued. So the officials from Ekurhuleni, that was the first time that they heard of the presentation from the store, the same time as I did. So we were not going to be lenient to them, much as we understand the plight of the people who are on chronic medication, that at least you need to protect them, but protect the employees and protect anyone who might walk into the store. So we advise them to close for the rest of today's afternoon, tomorrow and Sunday. Let them do the necessary things in terms of screening and testing is concerned, but as well as the disinfection. Well, they argued, and this is what a lot of people do. They argue that they screen their employees on daily basis. But we argued as well that, look, we appreciate that you do this thing, but here is the case. How then did you miss this person? So don't we want to do the right things from the word go, other than, pointing fingers tomorrow? Because I hate to say to a person, I told you so. And I think it's getting there. Yeah. And I'll say this for the second time, that I'm disappointed that each and every time we have to deal with people who are in the health sector. I'm not saying we will completely prevent this, but in a case where it shows its ugly head, let's converse. Let's inform the authorities so that we can work on this together. Yeah. So as things are now, we instructed at first they were a bit difficult. Why difficult, I don't know. It's as if people want to put the profit first of everything. They wanted to be difficult, but we were able to convince them, and they agreed that they will shut temporarily and do the right thing.
Is this a voluntary shutdown, or do you have the powers to force businesses to close for a certain area? I mean, what does the law say? What do the regulations say in a case like this?
No, we don't force them. We really advise, and I'm very much careful. I mean, I'm consistent in making the use of the word advice. I do not want to impose myself on anyone, but let's rather, come to our senses, all of us, to really understand that this virus is here. For us to want to bring in legal implications, who has got the right to do what, who has not, because you have a case in any way. So you can't just go and want to argue it legally. There is a case, let's do the right thing. If we do the right thing from the word go, we will suppress the infection rate, we will flatten the curve. Yeah. You've got a choice. You may want to argue that you are an MMC, you don't have the right to tell me to shut down or what. I don't want to refer to the previous cases where we advised people and they did not listen to us. And the next week, they had over 20 cases. So yeah. I'm just hopeful that they will actually understand that we are here to assist, to collaborate with them. Yeah. Look, we put our lives on risk. We pray that we don't take the virus home in an endeavor to actually flatten the curve. So we expect the business people to really play the ball as well, to come to the party and fight this thing as a collective and not us and them. I don't think the debate as whether or not one has got the right to shut it down will assist us at this point of time. Okay. What will assist us is it's when we put the interest of everyone's health at fore.
Yeah, so this is about being reasonable. So finally, MMC, if there are small businesses out there, even big businesses who are thinking, okay, what happens if we get a case? Just tell us what would have been the best thing for this pharmacy to do. How long should they shut for? What do you think is the best protocol?
I think the best thing is to really conform to the set out protocols. The health department is better placed to can advise appropriately and properly, other than wait for us from police, point of view to come and force you to do certain things. Once you have a case, open up, and you'll be disappointed if I can share with you information that is circulated on social media, which if we did not react on, you were still going to blame us for having turned a blind eye. People are saying they were advised not to say a word about it. Maybe it's only a sheer allegation, but if the store decided to keep mum about the whole thing, keep it quiet from the authorities, I would believe that what goes around in the social media is anything to be trusted. So back to your question, what do they need to do? They must just be open up, share with the authorities. They know of the protocols, communicate to the National Communicable Disease Institution of the, just share so that you can be assisted. It doesn't help to keep quiet and continue with business as usual, because in any way, we will still pick it up. Yeah. 95% of the cases that we have responded to, it's as a result of the issues that we picked on social media, the tip-off, and 95% of those turned out to be positive.
Sure. And I think sometimes people don't even know who they should contact. So you're saying the NICD, the National Institute of Communicable Diseases, or the Health Department in finality?
Or the Health Department. Yeah. I don't really believe that we operate in silos. We are in a country, we are in the Republic with its own laws. There are government departments. People cannot play ignorance here. That cannot be, taken kind. People know where to report this thing. I mean, we are now in the 7th, if not 8th week of living with the virus. And there are council command meetings, national command council meetings that are called, we know these things. So people cannot play ignorance and that they don't know these things. They must just do the right thing.
All right. Thank you very much, MMC of Community Safety in Ekurhuleni, Frans Mmoko.